we have a session on SDG10 Health and Reduced Inequalities by Ms. Mariam Aliyu. Ms. Mariam Aliyu is the Executive Director, Learning Through Skills Acquisition Initiative, or LETSI. She is a certified medical radiographer and a public health administrator with 6 years full-time working experience. Gender and child protection specialist with profound knowledge of safeguarding policies and interagency standing committee guidelines on gender programs and responses. Livelihood empowerment for vulnerable women and young girls as an output to enhance protection and inclusive gender programming in Northeast Nigeria, an expert with 5 years of working experience on community development, engagement, and advocacies in a conflict context. Mental health expert with profound knowledge in trauma healing and support, conflict mitigation strategy, and alternative disputes resolution at the community level. Thank you so much, Ms. Mariam, for joining us today. Over to you for your session on SDG10 Health and Reduced Inequalities.
Okay, thank you so much, Aparna, for having me. And also thank you, Santosh, for your consistent efforts to ensure that I'm here today. I really appreciate it. Like she introduced, my name is Mariam Aliyu, and I will be taking the session on health and inequalities. I think, like the previous speaker stated from South Africa, I really like the fact that you were able to really harmonize and analyze the conditions that we currently face as Africans. And I would also like to state that we have spoken a lot, we have listened to a lot of the speakers who have truly analyzed in context the issues that are related to inequality. And I'm not going to start by going back to what they've already stated. I'm going to go straight to health. And first of all, start by telling you what health is. When they say someone is healthy, it means you're mentally and physically, as well as psychologically and emotionally sound, devoid of any diseases or illnesses. That is what it means. And then when it states that there are inequalities, it means there are some factors that are preventing you from achieving sound health. And these particular inequalities are usually as a result of probably your social status level, your gender, usually race, ethnicities. And now this is where we are coming from. I have been a youth advocate for inequality for almost all my life. And one particular thing I try as much as I can to fight against is inequality at community level. Like she clearly stated while she was talking about, while she was introducing me, I am a development person. I work at community base. I look at more of sustainability, sustainable development, but I focus in deep rural communities. I work in the northeastern part of Nigeria, which is currently under insurgents, and I am going to go straight to also highlight the core issues that are affecting the rural aspect of Nigeria. Sorry, I'm limiting this strictly to Nigeria because I don't really have much time. I'm going to start by talking about poverty. Poverty has been a major condition that is limiting people from accessing quality health. And what are the government doing about that? What are people doing about that? We have tried as much as we can to solicit for more better infrastructure, to solicit for economic enhancement for people within the community so that they will be able to make some sort of money to access medical needs. But that is still ongoing, and that is a major condition that we are passing through. Because of poverty, a lot of women and young girls have not been able to access complete medical assistance because everything we talk about universal health coverage. Universal health coverage in Nigeria is also looking at the socio-economic status, because when we talk about that, it's only the people that are advantaged that have access to it. People that are disadvantaged, like those in the core rural communities where I work, do not have access to all this. And because of that, it prevents them from accessing quality health care. And apart from that, we also the countries are based the ability to access health by payment. Like you have to literally pay for everything. Like I think I had a case once in which a pregnant woman had to lost her life because of the fact that she don't have the sufficient amount of money she needed for her medical bills at that particular time. So these are some of the issues: poverty, and also lack of basic amenities. Sometimes we are still struggling in the rural aspects. You see, when we have this urban and rural divide, it also, it also put a strain in the ability for people to really understand, to see that there are human beings that are staying in that particular area and they have the right to equal access to basic needs, especially health needs. Health has effect for everyone. Health, if you don't have good health, it affects each and everybody. But then seeing that there are people that are of higher status, and then they are always been the kind of people that are being considered, and then the people in the lower status, who are those people living in the core rural areas, do not have access at all, is a major concern. And I would also like to state that whenever facility, whenever anything that has to do with probably access, like during the COVID-19 is another example. The first set of people that got access to the treatments, or sorry, to the vaccines, were people that were in the urban areas. And then those people in the core rural communities had, I think up till now we are still trying to see how we could divert it down there. They are still struggling, from having. So there is a need for us to consistently come together to find methods where we can do universal. Apart from the fact that universal coverage here in Nigeria is still under construction, like I always say, we need to all come together to find ways in which everybody can be involved. We can have a good equilibrium about all this, so that everyone can, have a more sustainable life, because that is the right of every human being. And also, in terms of policies and development, I know that one of the speakers, spoke about policies and development earlier, but I would just like to highlight that we, as advocates for sustainable development, we have tried as much as we can to solicit for changing some policies, especially in relation to equal access. We have tried as much as we can to involve people within the sectors, the lawmakers, come together so we can find ways for us to be able to strengthen access to basic amenities like this for people that are in the core community. Those are people that are in need. And I would also like to state that out of 100,000 live births in Nigeria currently, we have 854% maternal mortality ratio. I will say it again, 814 maternal mortality ratio per every 100,000 live births. That is a cause for worry. And that still boils down on the fact that, on the inequalities that we are talking about. And how do we reduce health inequalities? First of all, we need to provide approaches and measures to protect the most vulnerable. Who are the most vulnerable? Women and young girls, especially seeing that the community where we are currently in Nigeria is under insurgents, like the northeastern part of Nigeria, even the northwestern part of Nigeria that is currently under insurgents. We need to be able to understand the vulnerability of these people, to also be able to understand that these people, the vulnerable persons, have lost their source of income, and definitely readily make these particular amenities available to them, to ensure that they have a better health. Sorry, excuse me. And also, we need to develop an inclusive method and approaches. When we talk about inclusive method, do you bring everyone along? Do you understand? In developing our approaches and our program implementation plans, do you bring both the persons with disabilities along? Do you consider the type of disability? Do you have a disability disaggregated data? Do you have a gender disaggregated data to be able to guide your responses to people who are truly in need, especially in the areas of health? Do you have crutches, or do you have crutches? Do you have access? Even if they are being carried along, do they have the ability to be able to access, wheelchairs in the hospital, or crutches, or just something, or probably a handrail or something that'll be able to assist them to gain this particular. So we need, as humanitarian, I'm a humanitarian person working on the development sector, so I'm going to base this on the entire discussions on the humanitarian aspect. There is a need, if we truly are trying to ensure to enhance equity or equality, we need to be able to consider this, small facts that we think are really actually small, but they are actually really big, because they prevent people from getting the equal opportunities. And also, we need to accelerate preventive programs, which is inclusive of all persons. I have already stated that, and provide special healthcare services for those people who suffer from mental health. Another type of people who have been marginalized, that have been prevented for years, not being able, not having core access, are people with mental health. Even in some gender programming, when you talk about that, you talk about people that are highly, vulnerable, are people that have men, because they cannot really access, or they cannot really tell you what they are going through because of that. And also, so what particular programming in terms of, mental inequalities are we putting in place to be able to ensure that these people are also provided the access, the support that they need at that particular time? So that is something we also need to consider. So do we need to strengthen leadership and accountability as well within the systems. Like in Nigeria, we have always had a challenge in which, as it is right now, a lot of doctors are migrating to other countries, and then we have a shortage of doctors here in the country. And then apart from that, I understand the doctors are actually poorly paid, because as compared to other countries, I mean, every human being has a right to seek for greener pastures. So, but then how exactly are we going to be able to really understand, to support these people, to support these particular changes that will ensure sustainable development in this particular country? And this is another thing where we need to also come in. We need to consider this. And also, I know that at a point in time, there's this article that spoke about, I think, for one doctor is attending to 100 patients at a particular time. This is also another issue because of what there is lack of manpower to be able to handle this particular. So it still boils down to the government advocacy and sensitization, as well as probably lobbying with the government. So we also need to look at this particular area. So do we collaborate locally in planning and accessing health services and providing health services? Now, when we talk about collaborating locally, we mean at the local level. Like for instance, you work in maybe Kalagaru community. Sorry, I'm just giving an example. In this particular Kalagaru community, you know that there are community-based health workers. Of course, we know that we do not have very good healthcare amenities in those particular communities, because in fact no doctors are willing to work in rural communities because of poor payment, and also the facilities that are kept, they are always substandard most of the time. So what are you doing as humanitarian workers or as development experts? What are you doing to ensure that those particular people that are locally placed, have the right learning, the right education to be able to support women or girls or people that are in need of health services at that particular time? Do you bring them along? Do you train them? Do you involve the community leaders? Do you involve the bulamas? Do you involve those people who have, maybe the basic knowledge of, health services? Do you involve them in training? Because there are some training you need to give to those people to be able to give at least, even if it is a first emergency, first response before a better access is employed. So this is another thing we need to also consider. And also we need to also look at monitoring to ensure that no one is left behind. On as you partake, or as you condition yourself to ensure that you meet the SDG 10, right? That is the goal. But then do you go back to monitor, or you just go there, you implement your project, but then there is no monitoring plan? You have an evaluation plan. You have a post distribution or a post monitoring plan. Okay, you provided probably an awareness on maybe mental health and acceptance of all persons as equal in a particular communities. But then did you go back to that community to really understand if these people are accepting these people? Did you do any evaluation? So this is another area we will need to look at. So and also, I wouldn't want to take much of the time. I would also like to talk about the location of hospitals and facilities. Most times, when we put, even in some core rural areas, there are some places that are really difficult to be accessed by persons. So do we put into consideration this particular type of people, and if how, or make provisions for how they'll be able to access these particular locations? Like if you notice a particular location is waterlogged, and then people will not be able to access it because of that. Do you have anything in many plans in mind to be able to provide maybe like a bridge for people to be able to pass through to access those services? So as development experts, I feel like in achieving health equality, we will need to also consider this particular strata. I'm only going to talk about the basic aspects. These are the things. Actually, some of us who work as development health experts that work in these rural communities, do we need to put all these particular things I have mentioned into consideration to ensure that no one is left behind? There are also children out there. Children they can hardly really express how they feel at a particular time. So what measures do you put in place to be able to ensure that children of all, but from toddlers, every angle, are able to come in and access medical care? These are also areas. And also, I always talk about issues of payments, in the hospital. Like, if I have a health facility right now that I am running, I wouldn't put it on pay before service. I would actually treat you, make sure you're fine and you're okay before. But then I know a lot of, I know that it's not going to be the same way with everybody. But I would also employ us to be human and also to consider other people that are not up to the standards that you are. And as health practitioner, I will also state that when you are working in a particular hospital, you should try as much as you can to be equal. When I mean equal is this: a particular patient is with you and she does not have the same, probably she doesn't have the same amount of funding that the other person who is also seeking for the same health is with you. But then, because of the fact that the other person has more money than this particular person, even though this person came before him or her, you decided to treat the other person and then leave the other one. This has actually led to the loss of lives in the country. And these are things I know it's happening in different parts of the world, and I think we all need to look at this and see how we can sort this out and we can stop this. As advocates of sustainable development, sorry, I'm not going to take much time. As advocate of sustainable development, I still feel like we are working towards it. We are almost there, but then we need to still add more effort. We need to increase more effort, because deep within us at times we also segregate. We also marginalize. We just have some sort of sentiment within us that prevents us from actually doing some things, at some particular time. I know as humans we are not perfect, but I can also urge us to keep trying. I should try, as much as you can, to make sure that we bring each and everybody along and do not stop creating awareness. You don't stop creating sensitization. Issues of mental health is another issue that we all need to stop stigmatizing people about, because if we're really talking about issues that concerns or mental health concerns, or some of us might look healthy, but we actually have issues of mental health, and you might not even know it. But then we need to start to stop the stigma, and also to try as much as you can to accept each and every one. I wouldn't have much. I don't have any more to say. Aparna, I know you're already signaling me. So thank you so much for your time, Santosh. And Aparna, I'm actually done here, and I would be open to any questions.
Thank you so much, Mariam, for that excellent session. It was really eye-opening. We don't have time for questions, but as you said, when we talk about health, we need to really talk about mental and emotional health also, along with physical health. We have a lot to do towards achieving SDG 10 and to ensure no one is left behind. But together, I think we can do it. As you said, there is a lot more to do. Thank you so much for joining us today, Mariam.